Hi guys, welcome back for our daily practice questions. As always, you can first get into my introduction and disclaimer before getting started with our questions for today. For those of you who are familiar with me, hey y'all. For those of you who are new, welcome, welcome, welcome. I'm Dr. Brittany Weinstock, a family nurse practitioner and founder and CEO of the Nursing Studio. I provide resources, tools, review books, one-on-one sessions, Q&As, and more to assist nurses as well as nurse practitioners with successes in boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. And you know what? I always go by disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that we have tested on ECC as well as AANP. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number one for today. Question number one states, the nurse practitioner and NP student are discussing type 2 diabetes. What initial A1C level of diabetes diagnosis? Is it A, an A1C of 7, B, A1C of 9, C, A1C of 6, or D, A1C of 6.5? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend you send the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here the question states, what initial A1C level is indicative of a diabetes diagnosis? And the A1C of 6.5 or greater is considered one of the positives for a diabetes diagnosis, okay? Question number two, what random plasma glucose level is considered positive for a diagnosis of diabetes? Is it A, 126 milligrams per deciliter, B, 100 milligrams per deciliter, C, 200 milligrams per deciliter, or D, 110 milligrams per deciliter? Take a moment and tell me. All right, so what random plasma glucose level is considered positive for a diagnosis of diabetes? The answer is C, 200 milligrams per deciliter or greater, right? And not to be confused with a fasting plasma level. A fasting glucose level is 126 milligrams per deciliter or greater. A random plasma glucose level is 200 milligrams per deciliter or greater. And just think about it. If you're fasting, all right, you shouldn't have had anything in your system, right? So we expect it to be lower. Whereas if random, you may have just eaten or a little bit ago, so if you are a larger threshold to be able so random to make sure you repeat to the terms so you're not missing it just from a word of random versus fasting. Okay? And then lastly, question number three, when initiating insulin for type 2 diabetes, which insulin is typically first line therapy? Is it A, Novolog, B, Humalog, C, Lantus, or D, Felicity? Take a moment and tell me what you got in the comments. All right, you guys, so here, still the question, question still states when initiating insulin for type 2 diabetes, which insulin is typically first line therapy. And when we are considering first line therapy for insulin, so say your A1C is 10 or what have you, whatever reason you want to initiate the insulin, you want to go with a basal insulin based off of the American Diabetes Association meeting. They recommend starting with basal insulin, meaning it's going to be your intermediate and your long acting insulin, things like your NPH, those your long acting, your so your best insulin here, but the choices are C, Lantus, right? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure you here. If you need any of the resources that I do offer, feel free to reach out to us here by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot an email to leadershipstudio@gmail.com. Also, the antibiotic worksheets that y'all have been asking about, I did a posted link with the link to it earlier today. So just go to the post section and you are able to do it. And I'm also going to add it under the bio of this channel. Okay? All right, you guys, y'all know what to do. Make sure y'all meet me